Some of the new questions are about the patient-provider connection, which means how much does the patient feel like they trust their provider, how much they feel listened to, and that that provider has their best interests at heart. So these are the kinds of questions. So why is it important to include patient-provider connection in the choir questionnaire?
We gave these questions a lot of thought about how we would use them in the clinic. And we talked to patients, we spoke to providers, and really came to the conclusion that asking these questions at the third visit would be most useful. That's after the patients have gotten a chance to know the provider, that may have gotten to see some results of treatment. These are patients who are choosing to come back because inherently they feel some benefit to the service, and that's why they are coming back. And that we thought that would be a good time to assess if the patient felt that they could communicate well with their provider, if they felt that they could trust their provider, and that would give the provider an opportunity to address any concerns. So the way the questions are structured is that they do not appear on the choir report, and when the patients ask the questions on the tablet, it says that the provider cannot see these answers, but that we encourage the patient to bring up any concerns they have over communication with the provider or being open about any of their problems as much as possible. So that in that sense, it's not something that the provider has to bring up. It is something that the patient on their own can bring up if they choose.